Deloitte Digital has been a key partner in co-developing solutions on our new Agentforce Life Sciences platform, including the recently announced Agentic Patient Services suite, a groundbreaking solution using generative AI to overhaul the entire patient experience, from intake and onboarding to adherence and care. We are thrilled to be joined by Ryan Myers, a leader in the life sciences practice at Deloitte Digital. Ryan, thank you so much for coming to the broadcast. Okay, start with the big picture. What's the biggest headache or delay that life science patients currently face, and how does the AI-powered suite help cut through that complexity?
Well, we think there's a huge opportunity in life sciences, specifically around patient engagement and patient services, to elevate the patient experience through automation, through leveraging data and insights and AI to create sort of more personalized experiences. Historically, patient engagement and patient services has been done through programs that were more reactive in nature. But with the advent of all this new technology and AI, there's a real opportunity to create services that are more predictive, more proactive, that can really sort of meet patients where they are in their journeys.
That's great. We were talking earlier, and you mentioned it's almost a true consumer-like experience now. And a lot of this complexity is solved with this technology. So can you share an example of a workflow where this level of automation is achieved, and what's the impact on employees and overall patient time to therapy?
Some of the workflows, going back to the concept of a patient services program, tend to be very manual and sort of administrative in nature. It's funny that we're talking about agentic AI, and in the same sentence, I still think about fax machines because enrollment in programs still involves a lot of faxes, and there's a lot of workflow to collect the information about the patient, to enroll the patient into the program. Oftentimes, there's information that's missing on those forms, so there's a real opportunity to automate through, workflow, for example, the collection of that missing information to pre-populate the sort of enrollment, get patients into the programs faster, and ultimately get them on therapy, more quickly.
And we talk about experience, but it's also that productivity, because there's still times when you go into physicians' offices and you're filling out a lot of paperwork. A lot of times you're doing that in a repetitive manner. So if you have similar appointments, you're doing the same paperwork over and over and over again. And so I think there's so much opportunity to kind of address some of these legacy processes, and this is doing a lot of that. So that's amazing. So we've gotten here very quickly, but looking ahead, it's hard to do sometimes, but what's the most exciting new capability or use case that you're seeing emerging as people are looking at adopting this platform over the next year, and what role will Deloitte play in bringing the next wave of innovation to market?
Well, it's really around the agents and finding those opportunities to use agents to move to more self-service, to help automate many of these interactions. And I recognize that there are some interactions that can't be sort of fully automated, that we will still require at times kind of a human in the loop, if you will, a human to intervene. But using agentic AI to really streamline, again, going the enrollment into the programs, getting the patients on therapy faster, and really just being able to help them stay on therapy and realize sort of the value and the benefits of the medicines that they're taking.
It's amazing. And then patients get better care. All of the providers are able to really have those deeper conversations that are more meaningful, and those mundane tasks, they can be automated. So that's absolutely wonderful.
And then the agents have more time to actually spend time with the patients on the issues that matter most, and it's less about collecting missing information, and it's more about helping them overcome whatever sort of challenges or barriers they might have, like realizing better treatment.
It's amazing. Ryan, thank you so much for being with us, and thank you all for watching. To learn more about how Deloitte Digital and Salesforce work together to help transform the patient journey, scan the QR code on your screen.